Hi, everyone. Thank you for joining us today. My name is Lori Marie Pashota, and I'm the Executive Director of the Mental Health Association of Rhode Island. We're a small nonprofit based in Rhode Island, and our mission is to promote and nourish mental health through advocacy, education, and policy development. COVID-19 is not just a medical crisis or an economic disaster. It's also a mental health crisis. And the isolation that we are all enduring right now just adds another layer of stress to that. I, for one, have a history of clinical depression, and recently I decided to get back in touch with my own therapist because I know that I could use some extra support at this time. And so when we were putting together the idea for this series of workshops during May's Mental Health Month, I was really hoping that we could find someone to help answer the question of how can we cope? Life is very overwhelming right now. What can we do to cope with this? And so I was really lucky and very delighted to find Dr. David Dove, who is a local psychologist based here in Providence, Rhode Island, to join us today. He has founded Dove Psychology, which is his practice, where he works to provide an inclusive and supportive environment for a diverse clientele. Dr. Dove received his PhD in clinical psychology from George Washington University and concluded his training at the Alpert Medical School of Brown University. So welcome, Dr. Dove. Thank you so much for joining us today. We're really looking forward to this information. And folks, if you wouldn't mind, please holding your questions until the end of the presentation. And until that time, it would be very helpful if you could please mute your microphone so that we can eliminate background noise. So thank you again, Dr. Dove. And with that, I welcome you and turn the presentation over to you.
Thanks. I appreciate this opportunity to share, basically. David Dove, clinical psychologist here in Rhode Island for the past 10 years or so. The pandemic has presented a number of challenges, and I was excited when you contacted me as perhaps being able to use what I know to kind of share out and people can take it with them and maybe make some aspect of all this a little easier. So today I'll be giving you some tools and ideas to help you practice psychological self-care in these uniquely difficult times. The workshop is packed with exercises and hopefully brief educational components, but we'll be using exercises, metaphor, and examples to learn about handling our internal stuff, difficult feelings, troubling thoughts, feeling overwhelmed. And this will be a little bit like a bicycle riding lesson. You may learn as much by trying these things for yourself as we go as you do from hearing me talk. You'll see that many of the exercises are things that you can do by yourself. You can practice them alone. As we were developing these, we were all still in the safest at home, shelter in place part of the pandemic. And I think that you can do most of these in your residence by yourself. And I think that they travel well. So as you go out into your life and work your way back into whatever comes next, you can take these with you, use them as you go. We will do several guided meditation exercises, and you're invited but not required to participate in these. And you're welcome to turn your cameras off for privacy anytime you want that. And none of the exercises will require you to share information about yourself with anyone. Today I'm serving as the communicator of this information. Most of it has been developed over the past 20 years by a number of different researchers, psychologists, other providers, and a lot of it's available to you in book form or on the web. I'll put up some information at the end of the talk. The last thing I'll say is that this talk is not a substitute for mental health intervention or treatment. If you're in distress, certainly contact your provider, or if it's emergent, then contact emergency services. So being present is at the heart of these strategies. I hope everyone's up for it. We'll start now with an exercise to cultivate presence. We'll get to how this makes a difference for dealing with depression, anxiety, and other problems. But for now, let's just spend a few minutes noticing what's going on in the present moment. So you can keep your eyes open for this. I'll ask you to do it with curiosity. Do it without judgment as best you can, and do it on purpose. Start by simply noticing your hands. Notice them on purpose. Notice your feet. Notice the sounds around you. Notice the sights in the room. In case it's something you see every day, notice it with curiosity. Notice that you're breathing. And notice who's noticing. Now, notice that your mind is thinking. Just watch it for a moment. So notice as your lungs breathe and your heart beats, your mind makes thoughts constantly. And notice who's noticing. Well done, I'm sure. So May is Mental Health Month, and I want to take a second to speak to that. Okay. This year's theme is It's Okay Not to Be Okay. This is unique May in the history of Mental Health Awareness Month, I believe, since I don't think it's ever occurred in the midst of a global pandemic. So It's Okay Not to Be Okay speaks to at least one thing, and that's that pain is a part of life, and struggle and suffering are experienced by most of us. In our society, in our culture, we hear perhaps that the way that we feel is different than the way other people around us feel. There can be a big difference between the way that we feel and what our minds are telling us about what everyone else is going through. Certainly a difference between what we're feeling and what culture tells us like life should be. I think the theme speaks to that. And quick figures are that, in fact, 1 in 5 people experience depression in their lifetime, significant depression. 1 in 3 people experience significant anxiety. It interrupts their daily functioning. And then to bring it into the here and now, a recent survey had that over almost 50% of the respondents reported that the COVID-19 pandemic is impacting their mental health above and beyond the normal stressors and the normal things they're dealing with. So anxiety and depression, whether it's a part of human condition, daily life, or whether it's present in ways that seriously impact one's life, they exist in the best of times. And they're not taking any time off for the crisis. One aspect of the pandemic for me has been a loss of agency or loss of control. I think that there's so much we can't control about the situation, about the information that exists, the information that we receive, and about the resources available. I do believe that there are things that we can control and coping mechanisms, the first thing that come to mind. Coping strategies that are based on action, that are based on interconnectedness, and things that we do with our bodies. Those are all available to us, even if heavily adapted for safety, for social distancing, etc. So here are a few kind of quick take-home things that you can do in the minute, in the moment, that can make a difference for your mood, for your anxiety, for stress. The first is action, exercise. 30 minutes of activity a day has been shown to create demonstrable results in improving depression and reducing anxiety and anxiety sensitivity, and improving a sense of self-efficacy around handling mood and anxiety issues. 30 minutes a day is great. 10 minutes any day is great. And then interconnectedness, spending time with people, be that virtually like we're doing now, talking to trusted others is important. Finding ways to not isolate, even during the COVID crisis, even if you're in a 14-day quarantine, there are ways either through direct interaction like this or even liking things on Facebook or piping in when people are talking about Tiger King or whatnot. There are ways to feel like you belong. And then connecting to the community at a broader level, family, connecting with friends. The one good thing about Zoom is that whether the person lives down the street or around the other side of the planet, there's a Zoom meeting for everyone. And faith communities have also been important for folks. And they're the everyday things you can do, maybe already do many days that are good for you. Taking time to stretch physically, taking time to relax, even formal progressive muscle relaxation is good to really let yourself settle in and kind of get to your base and relax. Small things like making your bed, small things like taking a shower, fun things like finding a way to laugh. YouTube is great for that. So these strategies are available to you, and they're something you can use even when your mind doesn't want to. Some of these pass a test that I have, and it's that if I'm having a terrible day and everything sucks, what's the least aversive thing that I could do right now? And if that is taking a shower or making a bed or watching YouTube videos, so be it. The other set is behavioral. If you can get your body out the door to go for a walk, your head has to come along. I'm not saying that's an easy thing, but take your feet there and your head will join you. So we'll spend the rest of the time today talking about strategies that are useful for what goes on in here, in our experiences, the mental and emotional aspects of life. And there are 4 types that I'll introduce today. The first is mindfulness, and probably the most familiar is mindfulness. If you think about the exercise we did a few moments ago, mindfulness is a mental state of awareness, openness, and focus. Being present in the moment allows you to handle painful feelings and thoughts far more effectively in such a way that they have much less impact and influence over you. I do want to take a second and do another brief mindfulness exercise that gets at what it's like to practice it. Easier done than said. If you don't mind, get comfortable again, and we'll just do a brief exercise. So begin by settling your body comfortably, supported in your seat. You can arrange your head, neck, and shoulders so that you're upright, but not stiff. As we do this, you're welcome to close your eyes if that's comfortable, or you might just soften your focus where you're not looking at anything exactly. If you're comfortable, turn your mind's eye to your breathing. Just observe the rise and fall of your breath in your chest and belly. Though you may be tempted, there's no need to control your breath in any way. As best you can, just allow your body to breathe. Now, turn your attention back to yourself in your seat, noticing at this point the places where you make contact with your chair. Notice the sensations of touch or pressure at those points of contact. as you do this exercise, you'll notice that your mind tends to drift off. And it makes sense. It's normal. It's what minds do. Minds are prone to drifting off towards problem solving, wondering, worrying, predicting, judging, a variety of other activities. When you notice that you've done this, just gently bring yourself back to this moment and resume directing your attention to my voice. Now, turn your attention to your feet inside your shoes. Notice the variety of sensations there. Touch, pressure, temperature. See if you can pick out each individual toe. If it helps, wiggle your toes a bit. Now turn your attention back to the sounds around you. And then back to your breath. Just watching the rise and fall of the chest and belly as your breath flows in and out. When you're comfortable, open your eyes. And that brief mindfulness exercise gave us an opportunity to do something that I think is central to mindfulness, to being in the present moment, and that's letting our minds go where it goes and then asking it to come back by redirecting our focus. Mindfulness is paying attention in a particular way, with openness, with curiosity, non-judgmentally, and on purpose. It's a practice, and each time you do it, you're building your ability, and it's helpful in the moment usually. So before we started the talk, I invited folks to see if they could find an object, a stone, a paperweight, a toy, fruit, ball, whatever, that we'll use in an exercise in a few minutes. Now's a good time to take a quick break, stretch, move around. During the break, you can get that object. And while we do that for, 30 or 60 seconds, see if you can just practice mindfulness for a moment. While we're taking a break, if there are any questions that you've already gotten, you can welcome to send them to me. I'll take a look. All right. It's now a good time for us to resume. Okay. So mindfulness was our first strategy. The next strategy is called diffusion. It's a made-up word, and perhaps the easiest way to begin to talk about it is like this. My hands are currently pushed together, pressed together, they're melded, they're welded, they're fused. And diffusion is the practice of undoing that. It's a practice of noticing, identifying, and distinguishing thoughts and emotions, feelings, and urges. And again, that's a bunch of words. So it's not a meditation, but you can join me in this if you would. Your hands, take a book out of them. I'm just going to ask you to Slowly bring these up to cover your face. Slowly. And what you're doing while you bring your hands up is noticing what it's like to take in information, what it's like to feel like you're participating in what you came here to do, what it's like to make decisions, you feel connected. Once your hands are covering your face, notice what that's like, and then slowly lower your hands, noticing what that's like to take in information, to feel connected, to do what you can to do. You all can rest your hands. I'll keep mine up where you can see them. And just to say that these are thoughts, feelings, sensations, memories, the stories we tell ourselves or learn about ourselves. And when they're like this, they are available to you. They're able to consider each one. There may be many that you don't like, but you can see them more clearly, see if there are any that are relevant to the moment or that are useful to you or where you want to go, and hopefully attend to them or act on them. And others you may know not to act on. They can be present without you doing what they say. There's a trick to thoughts and feelings and such, and it's that they're very difficult to get rid of. So the time and effort required to try to get rid of a thought and the limited effectiveness make it so maybe more meaningful to your life just to let it be. So it's allowing thoughts to have less influence over your behavior. It's another way of demonstrating this with what goes on in our minds. Let me see if I can get there. This is what you might experience on a bad day. So diffusion is letting thoughts come and go rather than holding on to them. What we saw there, the different thoughts that came and kind of faded away, there were some pretty tough ones in there. You may notice sentences that that would have been hooks for you. I know there were some in there that my mind would want to take and hold on to and wrestle with, prove, disprove, etc. Diffusion is letting the thoughts come and move on by. I'd like to do an exercise with you that gives you a chance to experience that with your own thoughts. So we will switch gears. You're invited to participate in this visualization. You can turn off your cameras if that gives you more privacy. We're going to settle in again. Letting your seat hold you. Letting gravity hold you. With each breath, you can settle in. Turn your attention to your skin, noticing where it makes contact with the air. And notice the sensations there. Pressure, temperature, perhaps the movement of the air. Find yourself focused there. Now turn your attention back to your breathing. And begin to imagine that you're sitting next to a stream. You can fill in your visualization with your own memories or ideas You're sitting next to a stream and you can notice the sounds there. Notice the movement of the water. And notice as you gaze at the stream, a number of leaves are on the surface floating by. Spend a moment watching the leaves slowly drift down the stream. Observe each leaf come closer to you. Watch it slowly moving away, eventually drifting out of sight. Now, when a thought comes along in your mind, put it on a leaf and observe the leaf come closer to you and watch it slowly moving away, drifting out of sight. You return your gaze to the stream, waiting for the next leaf to float by with a new thought. When a thought comes along, you put each one on a leaf, observe each leaf come closer, watch it slowly pass by, eventually drifting out of sight. If one comes along again, put it back on a leaf, let it drift by and out of sight. Think whatever thoughts you think, allow them to float freely on each leaf one by one. If you find that a thought has pulled you out of the visualization or pulled you into the stream, notice that and return to sit next to the stream. If you like, you can allow yourself to take the perspective of the stream. Being the stream, you hold each of the leaves and notice each leaf and the thought it carries as it floats by. You need not interfere with them. You just let them flow and do what they do. We'll continue for a few moments silently doing this practice. Now let go of those thoughts and gradually widen your attention, take in the sounds around you. Notice the sense of your body seated in the present moment. When you're ready, open your eyes. That's a nice one to reflect on. There are usually patterns to the thoughts that we see floating by. There's certainly usually patterns for me at least, and the thoughts that pull me out of the visualization or pull me into the stream. We often get hooked by, each of us have our own hooks, but hooked by rules or by the past, by the future, by the dreaded future, by ideas of ourselves, reasons, and certainly judgments or criticisms. So diffusion is a means of noticing what's going on emotionally, noticing what's going on in your mind, and having a way to be a little bit separate from it. And certainly separate enough to decide whether to act on it, to know that it will pass, and so on. Mindfulness and diffusion are seem to be the most accessible ways of addressing something that's going on in the moment. To notice what's happening for you emotionally, psychologically, to identify it well enough to disconnect a bit from anxiety stories, catastrophizing other anxiety stories, or the depression critic many of us have inside, the martyr, or other stories that drive a lot of what we do, how we feel. The third strategy today is the observing self. The observing self is great for handling urges. And what is that? So the observing self is maybe best put in words as recognition that you're bigger and more permanent than your life's worth of thoughts and feelings, stories. You contain and can observe the inner events. Let's do a slideshow that may carry that to you more clearly. Watch these for a moment. So the observing self is the larger, more permanent you. But whatever your sense is of how well you're handling what's going on, you are more permanent than it. I like the weather in the sky metaphor because of how different things can be and how quickly things can change, or how things that change very slowly still change. Another metaphor for this is that you are the stream, and the thoughts and such are in contact with you, but they are not you. There's a way of dealing with this in the moment. You probably won't be living a life where, oh, I'm a stream. In the moment, it may look more like what we'll do now. Think of a self-criticism. Let's go to self-criticism. Something you're willing to play with a little bit for the next minute or two. I'm too blank. I'm not blank enough. I ruin everything. When you have one, just hold it. Make it succinct if you can, something short. I ruin everything. Say it to yourself in your mind. Say it with some conviction if you can. I ruin everything. Now, I'm going to say the same thing with another phrase before it. My mind is telling me I ruin everything. My mind is telling me I ruin everything. Say that to yourself a time or two until it feels natural. And then I want to add one more phrase. I'm noticing my mind is telling me I ruin everything. I am noticing my mind is telling me I ruin everything. I am noticing my mind is telling me I ruin everything. In that final version, it is the observing self who is doing the noticing. So the last tool for today is willingness. And that is a word that we all know. It's meant to replace acceptance. So willingness is a practice of moment by moment, of making a moment by moment choice to be in contact with what you're experiencing. And it is difficult not to get metaphorical. So willingness is to keep your hand resting against the wall. It's not to pull away from the wall. It's not to try to push the wall away. And it's not to be the wall. It's to maintain contact with the wall. To have sadness in the moment without being sadness, without doing some of the things that may be unhealthy that we do to avoid it or to run away and escape from it. And actually, I'll say this. It's not giving in to resigning oneself to I am worthless, resigning oneself to drowning in self-loathing. It's more like making space for one moment or momentarily stopping struggling with sadness, momentarily stopping struggling with the story that I am worthless. And you might expect that I think this is better conveyed through an exercise. The stone or object that you found earlier, we're going to use that now. There we go. So grab your stone or object, and for now you can just keep it right within reach. Again, we'll begin by sitting comfortably in a settled position that facilitates being in the present moment. What we're going to do in this exercise is try to interact in a different way with painful thoughts and feelings. And I'll have you pick from your experience one thought, one feeling, one experience that you're willing to do something playful with for a few minutes. Feel free to pick a painful thought or feeling that's small, something you're unlikely to feel overwhelmed by right now. Think back over the past few weeks and recall some time when painful thoughts or feelings showed up inside of you. And hold those moments in your awareness. Notice if you find yourself struggling with the memory and do your best to allow it to be. When you have it, bookmark it, and we'll come back to it. So now it's the time to pick up your stone, your object. Hold it gently in your hand. Notice how it feels in your hand. Notice its weight. Notice the muscles your hand uses to hold it. See the contour and shape of the object. Notice its texture and temperature. And you can roll it back and forth in your hand, or move it on your fingers to get another sense of it. Now, imagine that thought or feeling could come out of your body and pour itself into the object. Just imagine that thought or feeling is right there in a physical manifestation, however you make sense of that idea. And feel its weight. Again, if you're struggling a bit, notice that. So we'll practice sort of act out some metaphors for acceptance and willingness that give you a sense of what it means to be open to whatever shows up, even painful things. I'll instruct you to do something with your thought or feeling and do your best to follow the instructions however you make sense of them. See if you can let go of thinking too much about it and just act. I usually like to close my eyes when I do this and keep the object in my hands. You're welcome to do whatever's comfortable for you. So begin by focusing again on the thought or feeling in your hand. Feel its weight. First, I'd like you to give it permission to be where it already is, however you make sense of that. Give it permission to be where it already is. Next, welcome it like an invited guest. Now, open up and make room for it. Next, soften up around it. Now, see if you can let go of struggling with it for the moment. Next, take a moment to observe it like a curious scientist. Observe your painful thought or feeling like a curious scientist. Now, breathe in and out of it as if your breath were flowing in, filling it up, and then flowing out. Next, hold it lightly as you might hold a dried flower. Now, hold it lightly like you might hold a butterfly that's just landed on your finger. Now hold it gently and compassionately as you might hold a baby or small animal. Now, hold it gently and compassionately like you might hold a crying baby. Think back over the various metaphors I've offered and pick one that seems to be most resonant, most relevant to you. Enact that metaphor again for the next few moments. Now return to the present moment by noticing your breathing as it flows in and out of your body. Notice how the rise and fall manifests itself in large and small ways throughout your body. Tune into the sounds of the room and return to this present moment and set aside your object. You can reflect on what that exercise was like for you. What metaphors were especially resonant for you? Which ones were not? And what would it be like to treat some painful thoughts and feelings in this way? I find that different ones work for me at different times. Today, inviting it in like an invited guest was difficult or laughable. Other times, holding a crying baby. It's my baby, but it is crying. Willingness is a practice. Willingness is, can I have anxiety and do this thing that's really important to me in service of something I really care about? Can I have anxiety for this moment? So these are the 4 types of tools: mindfulness, diffusion, the observing self, and willingness. They're likely to change your experience of depression, anxiety, difficult thoughts, feelings, urges. The tools are actually meant for construction, and they which is to say they're actually not meant to eliminate negative experiences. They're not meant to get rid of difficult thoughts and feelings. They're meant for construction in the sense that they help to build flexibility, to let you show up, and improves your ability to choose what you want to do with the moment, with the feeling, with the situation, to act in your own life based on what's best for you in that situation. Overall, you're constructing behaviors and habits, lifestyles that manifest what you really care about, like what you value. Attendance today, for some of you, may reflect the value of health and self-care. Let's stop there. If you want to know more about values or committed action or the things that we did talk about today, you can dig into one of the books that I'll put up in a second, other materials. And there are several therapists in the area that use this approach. I think now is a good time to take questions.
Thank you so much, Dr. Dove. I'm struck by the immediate effect that these exercises have had on my central nervous system. I definitely feel like that wired feeling, that anxiety that I live with every moment of my life and pretty much my whole life. I feel like it's come down a few notches, and I feel like there's a little bit more space to let my guard down a little bit. But that's so interesting how mindfulness and these practices that you just went over have that immediate effect.
Mm-hmm. Yeah, I like the quick fix of it. I like that it's immediate, and that it's building something long term. But it's nice to have that option in the moment to kind of work around some of that stuff, especially anxiety that's built out of our thoughts and our feelings, and it has a body component and it has a behavioral component. Some of the things we did today, I think, are useful for calming the body, letting it send a message up to your brain that things seem pretty okay down here. Yeah.
Does anyone in the audience have a question? You can feel free to unmute your microphone, or if you prefer, type it into the chat box. I think we have a new message. Let's see. What is your favorite ACT metaphor for managing in COVID?
My favorite ACT, well, a classic ACT metaphor is like the passengers on the bus. You are the bus driver, and your mind, or however you want to conceive of it, is the bus. And you're going along, you're trying to do your thing, you're trying to live your life, go where you want to go. Passengers are getting on and off all the time. Some passengers are unruly thoughts and emotions, and they're kind of terrible internal things. Their story is that you better do what they say, drive the bus where they tell you to drive, or else they're going to come up to the front of the bus. Their thing is always, we're going to come up to the front of the bus. They look pretty scary back there. And so is it best for you to pull off on the side of the road when they say, to stop the bus when they say, to never get the bus started because of what they'll say, never get the bus started because you know you're going to be picking some of them up across the course of the day. And when one is in the zone, we might say that the passengers are getting on and off the bus, the driver's doing their thing, going where they want to go, sort of being who they want to be, being willing to have the stuff in the back of the bus, like talking and trying to be unruly and threatening to come up and stop the bus or whatever it is they threaten to do. Because that's really the only way to get where you're going, is to let them on and let them off as they want. And oftentimes just to let them talk too, because stopping the bus to go to the back and tell anxiety to chill out, or telling depression to lighten up, or whatever it may be, the bus isn't moving. So that's adaptable enough to where each week of COVID that seemed like an entirely different world to live in, including needing to change directions because things don't work the way they used to, the passengers of the bus have been there, and the idea of there's a road for this. There's not quite a map, but Gina has said we're going to go northeast today. I can get in my bus. I can do that. You know, yeah. So maybe that's a good one for right now. If you have one, type it in. I'd be curious to see what it is.
May I ask another question?
Please.
Can you say a little bit more about the difference between willingness and acceptance?
So what I would say is not that willingness and acceptance are different, but rather that they are the same. So acceptance and commitment therapy was the original name for it, and still is the name, but acceptance is a difficult idea because we often think of acceptance as like surrendering, surrendering as in kind of laying down and giving up, and or somehow coming to, yeah, acceptance just has a vibe that people interpret it in a way that's a little different than what we mean. Willingness is more of what we're after here. Willingness is like, can you have a disliked neighborhood member come to your block party? You know, you don't have to, like, in this moment, I don't have to love that person or anything like that. I just need to let them come. There's a metaphor about that. An unwanted party guest, you spend the whole night of the party at the front door trying to keep that one out, rather than going ahead and letting them in so you can go enjoy your own party. They'll do what they do. That's acceptance.
It sounds like willingness is more intentional and more, it's an active choice.
It's an active choice, yeah. And it's not to say that you're going where your pain leads you. It's not like I have to go where my pain leads me. It's not like I have to stay in unhealthy or dangerous circumstances. Not that at all. Willingness really brings up the choice aspect of it. Can I choose to be here now, and usually in service of what I really care about or what will be best for us?
Thank you. Thank you. Any other questions from our participants today?
I hope that it's been useful. It's a lot of information pretty quickly. I'll put up some books in a moment. There's one called The Happiness Trap by Russ Harris. That's a nice introduction to the ideas that I brought up today. And let's see if I can bring that up now actually for you.
I love book recommendations.
So books seem a little bit old school to me, but they're nice in that they're organized. The internet is like actually full of great ideas. The two books there, some of the folks who developed these ideas have organized them in a way that makes it clear what you're doing and why you're doing it, what helps. Having a therapist is useful in myriad ways. With this stuff, having a therapist can help to put it in context and to apply it to your life and to whatever your struggle is today. The last thing on that list is the ACT organization's website, and that part of the website is for the public. It includes some audio of some of the exercises that we did today. It includes access to a search engine for therapists that practice ACT or that use it heavily in their practices, and some other nice resources.
Thank you, Dr. Dove. Do you mind putting your contact information back for anyone who might want to contact you? Oh, perfect.
Sure. If I can provide like references for what we talked about, or if you need the information that was on the last slide or anything like that, certainly email me.
Well, thank you. Are there any last questions before we disconnect for today? Okay. Thank you, everyone, for joining us today. And thank you so much, Dr. Dove. This was really terrific.
My pleasure. My pleasure. And thank everyone for being a part of this.
This was definitely helpful. Thank you so much. I hope to see you soon.
Sure. I'll have to set that up.